This year, almost 800,000 people will have a stroke. Let that number sink in because it's a serious problem. Signs of a stroke include face drooping, arm weakness, and slurred speech. It happens when a blood clot or a rupture cuts off oxygen to your brain and your brain cells die. Our Sally Hernandez explains why it's not only matters how fast you get help, but where you get it.
The American Heart Association says you want to go to a hospital that is enrolled in its stroke database called Get With the Guidelines. That is a database that allows doctors access to the most up-to-date scientific guidelines in treatment, all at their fingertips. More than 3,000 hospitals are enrolled nationwide, including 14 in our area. But some outlying rural hospitals are not enrolled. And that's because hospitals have to pay up to $3,200 to be a part of it. But the American Heart Association says it is worth every penny because hospitals, they say, that follow those guidelines are saving lives at a higher and faster rate than ever before.
Wasn't it all right the way I felt?
Deborah Borja had one stroke but ended up at 2 hospitals.
My brother here helped her into the vehicle.
Her first stop was a nearby rural hospital her family drove her to because they thought it was faster than calling 911. But time was quickly running out.
How's Nana doing? How's Nana doing?
She'd lost her speech, she'd lost her vision. She wasn't able to walk right.
Deborah needed more specialized stroke care to save her life.
Hello.
In comes neurologist Stephen Warrock of Seton Hospital. When Deborah was transferred here,
Okay, these guys can come in.
she started to make progress. The doctor credits a robust commitment to stroke care and the Get With the Guidelines database for fast treatment and fast recovery.
It is a very effective tool, and it actually discriminates based on what national world experts say. These are the important things you need to work on, not necessarily those other things, but these are the important things.
Does Get With the Guidelines translate into better treatment if I'm a patient?
If you go to an area and this hospital is participating in Get With the Guidelines, that one's not, it tells you a lot about a different level of commitment to stroke care for the community. So I definitely go with the one that is.
Deborah may not have known where to go at first or even to call 911 to get her there.
She was being hard-headed and didn't want to go.
But she knows it could have ended much differently had she lost any more time getting here.
It's scary. It really is. I mean, my mom's the rock of the family.
I think she was saved from a terrible disability.
The American Heart Association says it does offer those rural hospitals a discount if they want to enroll in the program. And we also wanted to know which hospitals are enrolled in the Get With the Guidelines program, but a representative said they couldn't tell us that information because it is part of the hospital's contract that they sign for privacy. But for a list of recognized hospitals in stroke care that is made public, go to our website, kxan.com.
Thanks, Sally. The Centers for Disease Control and Prevention breaks down how many people die from strokes each year. In 2017, it was almost 11,000 people here in Texas. The darker colors on the map you see here, Texas bordering states like Oklahoma and Louisiana, that's where more people die from strokes. In 2016, stroke was the 3rd leading cause of death. It was only surpassed by heart disease and cancer. Here at KXAN, we're committed to helping you learn more about your health, along with our partner, the American Heart Association. For resources and easy tips to live healthier, just go to KXAN.com and click on Simple Health.